My common sense approach to Babesia. I had a patient who didn't get better after a month of doxycycline for Lyme disease. 6 months later, she was still sick. It turned out that the deer tick also transmitted Babesia, a co-infection. After treating her with azithromycin and atovaquone, she recovered successfully. Another patient unknowingly had Babesia and donated blood. The recipient of the blood transfusion developed Babesia as a result. As we enter another summer, it's important to recognize that Babesia is an increasingly concern. As we enter another summer, it's important to recognize that Babesia is an increasing concern as a tick-borne pathogen. The first case of babesiosis caused by Babesia microti parasite was identified in 1969 in a person who had vacationed in Massachusetts. Research by Krause and colleagues in 1998 found that 24 out of 46 untreated Babesia-infected subjects had Babesia DNA in their blood for an average of 82 days. Babesia can lead to serious health issues, including atrial fibrillation, non-cardiac pulmonary edema, and anemia. In New York, between 1982 and 1991, 7 patients with Babesia died, and on Nantucket Island, another patient developed pericarditis and died. I've seen patients remain chronically ill until they were treated for Babesia. This highlights the importance of considering Babesia in patients who don't respond to standard Lyme disease treatments. Babesia can be transmitted through blood transfusions and, though rare, from a pregnant mother to her unborn child. Pregnant women should take extra precautions to avoid tick bites and exposure to infected animals. If infection occurs, immediate medical attention is crucial to protect both the mother and the baby. Treating Babesia typically involves a combination of antimicrobial medicines. The standard treatment includes atovaquone and azithromycin. Clindamycin and quinine are also used, but have more side effects. And recently, a new drug called atovaquone has been introduced for patients who relapse after standard treatment. According to a study by researchers at the Yale School of Public Health, adding atovaquone can be a lifesaver for vulnerable patients. These treatments can effectively reduce the parasite load in the blood and alleviate symptoms. It's important for patients to complete the full course of treatment to prevent relapse and ensure the parasite is fully eradicated. For patients with weakened immune system or the elderly, longer or repeated courses of treatment may be necessary. Being vigilant about Babesia, especially in patients who don't respond to Lyme disease treatment, can make a significant difference. Proper diagnosis and treatment are crucial for effective management and recovery.